Good morning, everyone. Thank you so much for joining us today here at Senior Marketing Specialists with our longtime partners over at Mutual of Omaha. We are thrilled to have you guys today to talk about Medicare supplements and how they pair their dental plans together. Everyone knows that Medicare supplements and DVH plans go hand in hand together, so we're excited to talk about Mutual of Omaha specifically here today. My name is Sadie Palmer. I'm a team leader of training and education, and I'm just going to host you guys through this. But the presenter here today, the real star of the show, is Christy Meyer. She's also a longtime partner here with us today. She's the national sales director. We love working with Christy. She's the perfect person to have on here with us today. But before we get started, I have a few housekeeping items. First things first, today will be recorded. We understand that time is very valuable this time of year, so we don't want to keep you on here too long, but today will be recorded if you have to hop off. There will be a follow-up email with the recording in it afterwards, so you'll have access to that, and then it'll also be on our YouTube page as well. And then as always, we love whenever you guys interact with us. The more questions you ask, the more you get out of it. Makes our job a lot more fun. So please feel free to ask questions throughout the webinar. I will try to interrupt politely, Christy, to get those questions answered throughout it, but please throw them in the questionnaire box. Only I can see your questions, so no stupid questions at all. But Christy, I will go ahead and be quiet and let you get to it.
All right, thanks, Sadie. Thank you, everyone, for joining us today, especially during this busy time of pre-AEP. But I am excited today to talk about both our MedSup and dental plans and a little bit of activity that Mutual of Omaha has done here recently to continue to improve upon our broker experience that we do offer you each and every day. I know many of you are familiar, of course, with Mutual of Omaha, but I always like to start here just as a reminder for you all as to who we are and what we do best. So really from a company perspective, I mean, your clients are going to know who we are. We have been around since 1909. That's over 115 years of experience at work for you. And then we are really, really proud of our financial ratings that we do secure from third-party rating agencies, that we continue to have our A+ rating with AM Best. This strong mark really means that we're going to be there when your clients really do need us most, which in the case of a Medicare supplement is going to be, of course, at time of claim. But those independent rating agencies just means that we really are well positioned for our current and future financial obligations. With respect to Medicare itself, I mean, we really are Medicare pioneers. So we did issue our very first Medicare supplement policy in 1966, which was the first year in which Medicare began. At that time, Mutual of Omaha was actually selected to help the federal government administer both Part A and Part B claims through that federal program. And today we do hold the status of the second largest Medicare supplement provider in the country. Few more brief highlights regarding just the portfolio itself. As you're doing rate quotes for both MedSup and dental, do note Mutual of Omaha does not charge a policy fee or application fee, however that other carriers may deem those. So that could save your clients $25, $50 if they're applying for both a MedSup and a dental. Our MedSups are 12-month rate guaranteed from policy effective date. What does that mean for you? Well, we do allow for you to take applications for somebody aging into Medicare and going on to their Part B for the first time up to 6 months prior to that Medicare Part B effective date. So really, because we are locking in their MedSup policy rate for 12 months from effective date, really that's like an 18-month lock-in period for those open enrollment enrollees. And then our MedSup policies are anniversary rated, and that is simply going to mean that your consumers are going to be able to budget when they can anticipate a potential rate adjustment occurring, because it's always going to occur on their policy anniversary date. All right, I mentioned our exceptional broker experience, so let's talk a bit about that. We are known throughout the industry not to only offer exceptional customer experience, but also exceptional broker experience. So let's talk about a few of the things that we have worked on here of recent that have helped to increase the experience that you are having with us when you do business with us. And those are surrounding four main areas of focus. So, underwriting technology, reporting, and then some dental enhancements, which I'll talk about here in a few minutes. So, up front, let's talk about underwriting. Now's the time in which you are going to want to write these two things down, especially with AEP kicking off right now next week. So, you do have direct access to our underwriting team, not only the team, but also to that specific underwriter that might be working on a case for you. You can always call into that direct number here, 800-995-9324, and speak specifically to the person that is working that policy case. You also have the option, if you maybe have current customers that are on an older block of business, and maybe we have recently come out with new affiliate underwriting paper within their state. You, as the agent of record on that first policy, can request a pre screen for those affiliate and internal replacements and ask underwriting if they could potentially qualify for a rewrite. All you need to do is email msuw@mutualofomaha.com, provide the client name and current policy number, and ask if they may be eligible for a rewrite, and they will investigate and let you know. Now, they will tell you no, they're not eligible just based on claims history, or they will tell you to go ahead and proceed with an application. It's not going to be a guarantee of coverage. We won't know that until you take the app, but at least you would know ahead of time whether or not they may qualify for coverage. And at this time of year, that's definitely going to save you some time. And speaking of saving time, one of the big things we've worked on this year was our auto decision rate. So right now, when you take an e-application with us for MedSup or dental, if it any application type coming in electronically on the MedSup side, over 70% of those applications are going to auto decide within 120 seconds. So there's no more waiting of days upon days, wondering if your policy is going to be issued or not. You will know in most instances within that 2 minute time frame if that client is going to be able to have coverage or not. And you'll return back if it's issued, you'll get that temp ID card, you'll have the pending policy number right then and there. So you will know the status of that application immediately, which when it's AEP, that is saving you time to do what you do best, which is selling, not hunting down case status on applications. Next up, technology. So this has been a continued area of focus for us, and our e-app adoption does continue to grow. If you're not using that tool, I highly suggest you reach out to the team at Senior Marketing Specialists. They can help get you started, but it is very, very easy to use, not only for you, but for your clients. Right now, about 87% of our total applications coming in the door come in via the use of the e-app. And one improvement we made this summer was now when you do a combo sale for both MedSup and dental together, only one client signature is needed for both of those products. It used to be if you were selling both, they had to sign the MedSup app and the dental app, but now today they only need one signature and it will cover for both of those products, which is wonderful. Also on the technology front, and in the effort to help save all of you time during this busy time of year, is as of September 13th of this year, when you are doing an e-application or a paper application, you are no longer required to input the prescription drug information for your client. On the e-app, those screens won't even appear anymore. So that is definitely a big time saver for you, and it was a recent change. So if you weren't aware, definitely some great news for you on that front. And then another great enhancement we have done this year, continuing on work that started in 2023, was in continued improvements on you being able to get your book of business online. So we've made some recent enhancements there. A lot of them are noted here on screen, but all of them are available for you to look at and download your active book on our agent portal, which is Sales Professional Access. And then I promised one of the areas of focus we would talk about today was our dental product. So let's change gears and start talking about some product information. So we have had our dental product in market now since 2017. So going on past 7 years of experience within that block. And right now, with the enhancements that we have made, this product is selling like hotcakes. So issue ages, really, it's going to be anybody that you speak with. So the issue ages are 19 to 99, but the products really were designed to go hand in hand with our Medicare supplement portfolio. Both of the plans are guaranteed issue. The two plans are referred to as the preferred and the protection plan, and they are both zip code rated. Now, while they are designed to go with MedSup, you can sell them on their own. So you don't need to offer it with our MedSup, but I'll talk later about why you should do them together. But you can also sell our dental policies. Maybe you have some consumers that have had changes for plan year 2025 with their Medicare Advantage information that they have, and maybe some dental benefits have changed and maybe aren't as rich as or robust as they maybe had been. Cross sell this product for those individuals. Or maybe you're in a situation and while maybe Mutual of Omaha might not be the carrier of choice for their MedSup, maybe you want to go ahead and pair our dental for that individual because the product itself really is good. So let's talk about some of the product features, and I'll touch here on what those are. So the two plans, as I mentioned, preferred protection, issue ages 19 to 99. Key difference here with respect to the calendar year deductible on the preferred plan, which is the one here in the middle. For preventive services, there is no deductible. And then for basic and major, it's a $50 calendar year deductible combined. On the protection plan, there is simply a $100 deductible for all services combined in the year. Moving forward to the how does the coinsurance work for both of these plans? Well, on the preferred plan, I mentioned there is no deductible for preventive, so it pays 100%. On the protection plan, once they meet that $100 deductible for preventive, it would pay at 100%. On basic services, which is something like a filling or a simple extraction, on the preferred plan, it pays 80%, the insured pays 20, and then on protection plan, the plan pays 50% and the insured pays 50%. Now, this next slide, with respect to major services such as a crown or denture, is where we made some enhancements. So both of the plans now offer day one coverage for major services at 20%, and the insured would pay 80. That is a huge improvement over what it used to be, which was simply after 1 year, the plan paid 50% and the insured paid 50%. Now that's still the case. The big difference is going to be that day one coverage at 20%. So big improvement, and people are definitely recognizing that and selling this plan just like crazy right now. The other improvement that we made was with respect to the calendar year max benefit amount. So right now, with either plan, your client can choose between a $1,500, a $3,000, or $5,000 calendar year max benefit. I will tell you by far, most of the clients are choosing that $5,000 amount because when you look at the rates between the three options, it's very small difference between like the $3,000 and the $5,000 amount. And I have a rate example here toward the end that we can take a look at. And then I do think one thing that makes these plans stand out from the competition that's out there is they do offer a lifetime maximum benefit for implants, either $3,000 or $2,000, depending on the plan that your client selects. With respect to coverage availability, we do offer both of these plans in all states except for New York and Massachusetts. This is the current footprint map. And then if you were wondering what the numbers below the state name are, that is going to be the number of in-network dental provider locations available within that given state. So if we maybe look at example in Illinois, there are over 16,200 in-network dental provider locations that a consumer could go to. And you can see the rest of that on the map there. In total, that map does equate to over 406,000 in-network dental provider locations. And really the advantage of using a PPO plan is that your clients do have that flexibility to choose a dentist from a very large network of locations. They don't need to have a referral to see a specialist. The plan that we have associated ourselves with is the Dental Max Plus network, which does include dentists from Dentamax, the United Concordia, and the Connection Dental networks. But really using those PPO plans as opposed to other plans that might be out there is that it just means that by using an in-network dental provider, they are offering their services at a negotiated rate, which is going to mean lower out-of-pocket costs for your consumer. And in many situations, those negotiated savings, depending on where they live and the services that they are getting, those savings can range anywhere from 5 to 55%. So that can be significant for individuals as they're trying to budget their money. The other great difference when using a dental plan that is a PPO type plan is the fact that then there are in network benefits provided, but there's also going to be out of network coverage available for them. Now, the two plans do pay differently with respect to out of network coverage. I have those listed here. I'm not going to read them out loud, but I wanted to jump into just a couple of examples so you can really see the difference between the two plans and how certain services are going to pay with respect to in and out of network benefits being paid. So this next slide, I know it looks like a big number chart, which it really is, but as we look at maybe some common items that somebody may have occur within a given year with respect to their dental health, you can see here in pink is going to be the preferred plan in network, and the blue shading is the preferred plan out of network. So for something like we'll say bite wing images, the dentist's office submits a claim for $60. Because it's a PPO plan, the in-network amount allowed, $47. That's preventive care, so it's covered at 100%. The plan's going to pay $47. The patient would not have to pay anything. Same is true for out of network. The plan's going to pay for preventive at 100%. Let's jump down to something maybe a little bit more expensive. Let's look at if your client needed a crown with the preferred plan. In network, the plan amount allowed based on what the dentist submitted for a charge is $790. Because the plan now pays at 20% day one, it's going to pay after that deductible is met of $50, $158, and your patient would pay $632. So almost half of what the dentist office submitted. If they did go out of network for that service, meaning getting that crown out of network, the plan allows $1,259. The coverage is still paid at 20% on day one. After the deductible, the plan's going to pay $251.80, and your client would pay just slightly over $1,048. Let's look at the example on the protection plan, and we'll use that same example of that crown. So the dentist once again submitted an amount of $1,300. The in-network plan allowed amount is $790. The plan pays 20% on day one, which is $158 after the $100 deductible is met. And then your patient would pay $632, so less than half of the dentist amount that was submitted. With out of network benefits, the amount that is allowed to be charged is just almost $619. After the deductible is paid, it's going to be $123.79. And then the client would pay $1176.21. So I know this is a lot of numbers, but really I do have a story to tell here, which is I often do hear from agents, I don't sell dental. It's not worth the money and the premiums for a consumer for me to offer that. So I just don't do it. I don't offer it. But keep in mind, dental really is probably one of the number one things your clients are looking for. They've most likely had dental coverage their entire working career, and it's just another thing that they would be looking for because Medicare doesn't cover for it when they're on a supplemental plan. But I wanted to put the numbers together here to really show the value of having insurance and paying the premium and any associated deductibles, and that it does offer savings for your client. So in this case, it's those same numbers, and I did the math. And if you look to say, you know what, on the preferred plan in the zip code that was used for this examples, the annual premium is just over $676. It had a $50 deductible. If they went and did their exams twice a year, had their bite wings, maybe had a filling that had to be filled, and that crown, if you said, what is the savings over the cost of all of that, or just paying out of pocket as a consumer, is there any savings to that individual? And in every cell here, there is savings for that individual, including the fact that they're paying for their annual premium for the insurance plus any applicable deductible. Every cell, they are saving money. And think of dental insurance. Insurance is something you buy because you're going to use it. It is not something like medical insurance. Now you know you have to have it, but it's not something that in your head you're like, oh, I gotta go and get my dental exam and use my insurance that I have available. So dental insurance really is there for people to use. And if they are using it and getting the services that they need, in these examples, every cell, that individual with insurance would be paying less than the person who was just going to pay straight up out of pocket. Now, this was without our multi-product discount associated with it. If I add in our multi-product discount for the MedSup and the dental, the savings between paying for insurance or straight out of pocket, of course, is even greater. So once again, all of these cells, the individual with premium and any deductible is saving money over just paying for services out of pocket as they occur. Now, I mentioned this household discount, but I hadn't explained to you how it works. So when you sell our MedSup and our dental together, the dental receives a 15% discount. Now, I say do it together because you technically have within 30 days to have it done, but I know agents, and if you don't do it at the same time, you may forget and not go back within that 30 days of the MedSup policy issue date to get that discount applied for that consumer. So I'm going to show you here toward the end how easy it is to ensure that you're adding the dental at the time of the MedSup app. And then different from other plans maybe that are out there in the market. So I talked about our dental plans are truly just dental plans, but we do offer an optional vision rider. This vision rider is a reimbursement rider. You do have to have the dental plan in order to buy the rider. In most states, it's $8.28 a month. And then it does provide benefits for up to $50 every calendar year. And then it does also provide a benefit of $150 every 2 calendar years for either eyeglasses or contact lenses. And then I told you I had a little rate example in here, and I figured a lot of you maybe on the line today were from Missouri. So I did grab those. And this is just being pulled from our rate book. And I mentioned earlier the plans are zip code rated. So I just went ahead and said for the preferred plan in the protection plan, let's go ahead and pick the $5,000 max benefit amount for the calendar year. And how much does that turn out to be when we apply the multi discount of 15%? So the 6205 with the discount goes to 5275 or 633 annually. And on the protection plan, it goes from 2980 to 2533 or just about $304 a year. And remember when I said the most common benefit selected is the $5,000. Here you can see the difference between like the 3,000 and the 5,000. This is the monthly rate, but you can see it's very, very small difference between the two, which is why the majority of individuals are just going with that $5,000 out of calendar year max benefit. All right, so that was dental. Now let's talk about MedSup here for just a brief moment. You know us well for MedSup. We've been doing this, as I mentioned, for a very long time. This is our current state footprint map. and the color coding on it simply means what is the current new business underwriting company within that given state. So I am in Nebraska, and that is that light shade of orange. So that means in Nebraska, we are underwriting new business. It's Omaha Supplemental Insurance Company. The plans available are AFG and high deductible G, as well as Plan N. And then the number is the household discount percentage available within that given state. So in Nebraska, it's 12%. You will see some states, such as Washington, that have a 7, and then some states like Florida, which don't have a number at all. So let's talk about how does your client qualify for those household discounts. The majority of the map you saw has that 12% household discount. So how does somebody in most states get that 12%? It's very, very easy. It's one of two ways. They either live with their spouse of any age. That's it. So the spouse does not need to be Medicare eligible. The spouse does not need to have a Medicare supplement policy with us. As long as they are married and living together, that individual would qualify for the 12% based on that definition. The other way they can qualify is if they maybe have lived with somebody who's at least age 60 or older for 1 year. They would also qualify for the 12% discount in that situation. Now, I mentioned on the map there were a few states that had different numbers or no number at all. In North Dakota, the discount is 10%, but it works just like the 12%, which I just described. There are 4 states that have a 7% discount: Maine, New Jersey, Oklahoma, and Washington. What does the 7% discount mean? In those 4 states, 2 individuals within the household do have to have a Medicare supplement policy with Mutual of Omaha or one of our affiliates. And then there are a handful of states that do not have any discount at all available, and those are listed here on screen for you. All right, kind of shifting gears to talk about some of the value adds that your consumers can get by buying a Medicare supplement policy with us. I mean, people today are wanting valuable extras that are going to help them stay healthy and keep more money in their pocket. So we do have a few value adds, as we refer to them, that come available to them when they purchase their Medicare supplement policy with us. So the first one is iMed, and this is our vision discount program. And they receive this information within their policy information kit. But when they go to an iMed provider, they provide to them their discount code that they get within their policy output kit, and then they can receive discounts on eye exams and then things like lenses and frames. The next one is our hearing health discount, which is offered through Amplifon. In this program, your MedSup policyholders are going to get access to the Amplifon money-saving offers, such as discounts on hearing tests and diagnostic services, as well as follow-up care and 2 years of either free batteries or a charging station. We also have a benefit for advanced voice activated in-home medical alert systems. So this is available through AlloCare, and your clients can receive discounts on hardware costs as well as monitoring services. And then we also offer to your MedSup clients a 20% discount on Garmin wearables when they want to buy a new smartwatch to help track their fitness. And then speaking of fitness, we do have a fitness benefit available to MedSup consumers, and it's offered through our program known as Mutually Well. So all clients do receive discounts on things such as chiropractic, acupuncture, massage therapy, and they all have access to the Mutually Well app, which is going to give to them some online fitness videos, some walking goals that they can set for themselves, and just like healthy recipes. Those all come at no charge to your consumer. There is also an optional gym membership program that they can elect to be part of, which is $29.99 per month. So they would have access to over 10,000 fitness locations nationwide. They can stop and start at any time the program. They don't have to pay an enrollment fee. And anyone who does elect to join in with the optional gym membership would also have access to live content through Burn Along. So optional fee. Otherwise, you always get the free discounts in the app at no charge. And then just a few more perks that we offer with respect to buying a MedSup policy with us. We refer to these as mutual perks. That it's coupons and discounts on certain items where they can see deals within their area at a website that we have available to them, and they can receive discounts on some mortgage services through our mortgage side of Mutual of Omaha. Now, in most states, these programs can be talked about at time of sale. There are a few exclusions, and I do have those noted here on screen. All right, that was product information. Let's talk about some marketing information and programs we have available right now. So just recently on October 1st, we did announce that we would be increasing our MedSup Broker Bonus program amount to $200 on underwritten applications and $30 on open enrollment. So how do you qualify for that? Well, in each month in which you write at least 5 or more MedSup apps, you then qualify for that payment. So there's no cap to how much you can earn. So now's the time with the busy season of AEP to cash in on that incentive. We also offer to you our marketing credits program. This program is available when you write at least 7 or more MedSup and or dental applications. And the way the program works, it's based on the total premium amount that is collected on those applications. And then we add credits to your marketing credit bank. At time of when you want to redeem those credits, you submit your receipts for business growing activities that you have done, such as maybe you've bought leads, paid for postage, went to a conference and had conference fees associated with that. We will reimburse you up to the amount that you have in your bank. So it's just additional dollars for you to help grow your business. And then helping with social media, we do have some approved and compliant social media posts that are available on our agent portal within the social media hub. It's very easy. You just copy and paste the image in the text, and then you are ready to go and post that onto your social media feed. Just a great way just to help you get the word out there and know that you're doing it in a compliant manner. And then the other tools that we have new this year and available to everyone is a personalized URL. And these URLs do make it easy for a consumer just to sign up for coverage on their own. But do know when they do make a sale through your link, you are going to receive compensation just as if you had met with that person in person or talked to them over the phone. So how do you find those links? Once you log on to the agent portal, Sales Professional Access, go to the e-application tab, and then once you are there, you land on the dashboard, and there is a link here that says CF eApp links, consumer-facing eApp links. You click that button, and then your 2 personalized URLs will appear. Everyone has one for MedSup and everyone has one for dental. So copy and use the one that you would like to use, and then watch business come in the door just passively. Talk about a great way to save some time and energy this AEP. And then last but not least is our agent incentive trips. So we have been known throughout the years to offer really great agent incentive travel. This year for travel next year will be no exception. You are all earning credits to join us in Dublin, Ireland in the spring of 2025. So how do you get there? Well, all of the credits you've been earning so far this year are helping you to get there. You need 250,000 in total, and you do earn credits dollar for dollar for both dental and vision. And then on Medicare supplement internal replacements and affiliate conversions, you earn half credit. So you can always check your status. You can reach out to me. I can tell you where you're at, but we would love to host as many of you as possible because they really are amazing trips, and it's your opportunity to hang out with the best of the best in the industry. All right, so let's wrap this thing up and tie this thing all together and why MedSup and dental really are that perfect combo. So it's just human nature, really, when you are out and about. Nobody is going through the drive-thru and just ordering this sad, lonely little hamburger. we're going for that combo meal. Why? Because it's easier and it saves you money by ordering them together. And really, MedSup and Dental are no different. And we have made it easy for you to do so, especially when you do an e-application. So I wanted to run through that e-app process very quickly here today. Once you're within the e-application on Sales Professional Access, you will click e-apps. The MedSup and Dental one is the first one to appear on the list. Click the button that says Start eApp. You will then land on the dashboard, and to start an application for a new client, very easy, Start Application button. This is going to be the next screen that appears. So this is where agents sometimes get confused. So you do have two options. This is going to give you a quote for both MedSup and Dental. If you want only a dental quote, you would click Dental Quote Only, and that would allow for you to do that as standalone coverage. Otherwise, it's going to quote MedSup and Dental together. If you're curious, what are you completing a dual quote? What is that? That is, are you going to quote like a husband and a wife together? If that was the case, you would mark yes. In this situation, I'm going to do a MedSup and Dental quote together though. So this is what would come next on the screen. So this is exactly what you will see within the e-application. And you can see in every instance, the MedSup and Dental appear when you are doing the quotes. So in this example, my client wants to have Plan N, and they want to go with the preferred plan at $5,000. And I have an agent, he had a great way. He was very hesitant about selling dental, but this is how he overcame it. He talks to his clients and he's like, great, we agree. You're going to go with that plan N. Now I need to ask you this next question because it is on my screen. What are you going to do about your dental coverage? And it's right there. So it's prompting him to ask because it's here on his screen. And that is the way he is cross-selling with his MedSup by just simply saying, it's on my screen. I need to ask you this question. And he's been very, very successful at that. So as we continue through, my client wants, once again, that plan in with the preferred dental plan. And then the next screen is going to say, when do you want that coverage to start? Do you want it to start today or a future date? In this example, I had an open enrollment person and their birthday's in January of 2025. So I just said we'll have the dental and MedSup start at the same time. So January 1st of next year. Couple of questions. Is this a replacement coverage? Yes or no? And then next up is going to be the multi-product discount question. So this is the question that is applying that 15% that we talked about. And it says, are you applying for or have you applied for MedSup policy with Mutual of Omaha within the last 30 days? Well, yes, because I'm applying for both of those today. And you can see what happened. It will automatically calculate that 15% discount for me. So now the price of the dental has changed to $51.67. As we continue through here, really, I finished that application. At the end, it sends an email to your client to tell them that it's ready to be signed. And it's saying, hey, your MedSup and dental applications are ready for you. On my dashboard as the agent, you will see that that individual, Christy Test, has both MedSup and dental, and that they were both pending signature. Once the client signs, these would both change to application signed for both of those products. So very, very easy. And just a reminder, don't forget, we made that enhancement when you do cross-sell, both of them, one signature is going to cover for both of those products. And I went and I looked and I took a peek at our top of the leaderboard for agents that are on track for our trip. And when I looked at those, it is currently over 85% of the people who are top of leaderboard for MedSup with Mutual of Omaha are also cross-selling our dental policies. So it has become very, very popular product. Hopefully I've shown to you how easy it is to add that on when you're doing an e-application. And then sometimes I hear from agents, well, compensation really isn't that great on dental. And I would beg to differ. So of those people who are top of leaderboard, if I just take our average annual premium and how many policies on average each of them will sell this year, that on the very, very low end for compensation is almost $19,000. I would love an additional $19,000 a year. That is quite a bit. But maybe you say, you know what, that's too much. I can't do 85 a year. But what if you have a goal of just doing one a week? That also is going to add up. And on the low end, it's just shy of $12,000, which in the scheme of things, that is an additional almost $1,000 a month in income for you just by doing one dental app a week. So I hope you really take a look and start asking your client about their coverage needs for dental and give Mutual of Omaha a look, because we really are having some great success this year with both of our products with the enhancements that we made. And of course, we're going to wrap this thing up that better together. So there are so many things that are better together. I'm like, on top of my head, I can think gin and tonic, peanut butter and jelly, sweet and salty. How about Med Sup and dental together? And speaking of things to close this out today, what is better together? How about Mutual of Omaha and our amazing television show, Mutual of Omaha's Wild Kingdom Protecting the Wild? Season 2 of this wonderful television program did just launch on October 5th, and you can find all new episodes on Saturday mornings on NBC. So I want to thank all of you. I know it's a busy time of year. I thank you for your business, not only this year, but through many years of partnership with senior marketing specialists. And I wish you all great success this AEP. So thank you very much for your time today.
All right, thank you so much, Christy. There's a lot of information there. But guys, we're gonna go ahead and get into questions. We'll be here for just another minute or two, so go ahead and throw your questions in here. I do have a couple that just popped up here. Let's see. Can you mention extras while discussing MedSup? I believe that this is referring to, are you allowed to cross-sell with MedSups? Because we know that there's maybe some compliance stuff whenever it comes to Part C and Part D. But Terry, go ahead and clarify if that's what you're talking about. But with Medicare supplements, like she was talking about, you can cross-sell all you want. And yeah, as you saw in this presentation, they fit together quite perfectly. So
yeah, and Terry, if you're referring to the value adds such as the iMed and the Amplifon and the mutual perks, yes, you can talk about those items at time of sale, so meaning pre-sale, except for these exclusions listed here on screen. I'm going to guess you're probably in Missouri. So in Missouri, you would be free to talk about those things all at time of sale. So yeah, go for it.
perfect. And then let's see. Sorry if I missed it, but were there bonuses for the supplement and dental sales?
We do not have a bonus right now for dental sales, but we do have the MedSup Broker Bonus Program, which is on MedSup policies. So this is our standard MedSup Broker Bonus Program. And every month that you are doing 5 or more issued applications for MedSup, if the policy that you did was underwritten, it's going to pay $200 and $30 if it's open enrollment. There are a few state exclusions that just pay a flat $40, and those are listed here. So, but the majority of states, which are all of them up there, are paying the 200 or 30.
Awesome. And then guys, we have just one more question. So throw any of your, oh, I see a couple coming in here. I do have one question sent to me. Do you have any plans to have a tier that covers more than 50% for major services?
At this time, we haven't talked about any additional dental enhancements that we would be making, but we are very excited about the fact that on day 1, it does now cover at 20%.
Awesome. Let's see, compliant question here. Can you talk about this dental program if you're talking to someone about MA or MAPD?
As long as it's on your scope of appointment, then yes, you can talk about dental.
Awesome. Okay, guys, it doesn't look like we have any more questions. So if you have any follow-up questions, please feel free to contact our office, 800-689 2800. If we don't know, then we'll go ahead and ask our partner, Christy over here, and make sure we get that answer for you guys. But thank you so much for joining us, especially in such a busy time of year. And Christy, thank you so much for presenting so much information to us today.
All right. Thanks, Sadie. Thank you, everyone.
Thank you.